Welcome to Smart Wellness Tips, where we explore vital health strategies designed to save lives when every single second counts. A stroke strikes unexpectedly, cutting off vital oxygen to the brain, turning a normal day into a fight for survival. During a stroke event, nearly 2 million brain cells die every minute, making your immediate reaction the key to recovery. Knowing exactly what to do before the paramedics arrive can dramatically reduce long-term damage and save a loved one. Today, we will guide you through 7 essential steps to protect the brain and maintain resilience during a medical crisis. These actions are designed to bridge the gap between the onset of symptoms and the arrival of professional medical teams. Medical experts agree that stabilizing the patient immediately is crucial for preserving brain function and ensuring a better rehabilitation outcome. Let us begin with the first and most immediate action you must take when you suspect someone is having a stroke. You must sit down immediately to stabilize your body and prevent a dangerous fall that could cause severe secondary injuries. For elderly individuals, the physical trauma from a fall, such as a hip fracture, can be more fatal than the stroke. A head injury sustained during a collapse can complicate the diagnosis and worsen the bleeding within the already compromised brain. Dizziness and loss of balance are common symptoms, making standing upright a significant risk that must be eliminated right away. If a chair or sofa is not available, gently guide the person to the floor to ensure they are grounded. By lowering the center of gravity, you reduce the distance of a potential fall, protecting the head and vital organs. Sitting down also helps to calm the initial panic, allowing the person to focus on breathing and remaining fully conscious. Never underestimate the danger of gravity during a medical emergency. Prioritizing stability is the foundation of all subsequent first aid steps. Once the patient is safely seated, we must transition to the next critical position to optimize blood flow to the brain. Gently help the person lie flat on their back, ensuring their head and neck are aligned with their spinal cord. Lying flat effectively neutralizes the burden of gravity, creating a straight path for blood to travel from the heart. This horizontal position allows oxygen-rich blood to reach the brain more easily, which is crucial when circulation is compromised. During a stroke, brain cells are starving for nutrients. Improving circulation can significantly slow down the rate of tissue death. Do not place a thick pillow under the head, as bending the neck can restrict the arteries and impede flow. Keep the head neutral or use a very thin, support only if necessary to maintain an open and clear airway. Ensure that clothing around the neck is loose to prevent any external pressure on the blood vessels supplying the brain. This simple adjustment of body position is a powerful way to use physics to support the struggling cardiovascular system immediately. Now that the patient is lying flat, we must enhance the circulation further by adjusting the position of the legs. Gently elevate the legs approximately 30 centimeters, or 12 inches, by placing a pillow or folded blanket underneath the feet. This specific height is optimal for utilizing gravity to drain blood from the lower extremities back towards the body's core. Elevating the legs helps redirect blood volume from the legs back to the heart, which then pumps it to the brain. This step is particularly vital for older adults, whose natural circulation may already be compromised by age or other health conditions. By mechanically assisting blood flow, we compensate for the body's struggle and prioritize oxygen delivery to the most critical organ. However, do not elevate the legs if it causes pain or if you suspect there is a leg injury involved. This combined position of lying flat with legs raised is the gold standard for maximizing cerebral perfusion without medical equipment. Think of this as an emergency power reroute, sending all available resources to the command center to keep systems running. Physical positioning is crucial, but we must also manage the physiological stress response through controlled and purposeful breathing techniques. Guide the patient to inhale deeply through the nose for 4 seconds, filling the lungs completely with fresh oxygen. Follow this by holding the breath gently for 2 seconds, allowing the oxygen to be absorbed into the bloodstream effectively. Finally, exhale slowly through the mouth for 6 seconds, releasing tension and expelling carbon dioxide from the body fully. This specific rhythmic pattern helps to stabilize the nervous system and prevents panic-induced spikes in blood pressure and heart rate. Panic causes blood vessels to constrict, which is dangerous. Deep breathing keeps them open to maximize blood flow to the brain. Maintaining a calm state is essential, as stress hormones can accelerate brain damage during a stroke or ischemic attack. If the patient is confused, breathe with them, using your own calm presence to anchor them in this protective rhythm. While the patient breathes, you must perform a critical administrative task that will determine their eligibility for advanced medical treatments. Immediately make a mental or written note of the exact time when the very first symptoms of the stroke appeared. This information is the single most important factor for doctors deciding whether to administer powerful clot-busting drugs like TPA. These medications have a very narrow window of effectiveness, typically within 3 to 4 hours from the onset of symptoms. If the time is unknown, doctors may not be able to risk administering these drugs, potentially missing a cure opportunity. Do not rely on memory alone in a crisis. Write the time down or send a text message to yourself. Accuracy is vital here because administering treatment outside the safe window can cause bleeding complications rather than curing the stroke. Providing this precise data allows the hospital team to prepare the correct protocol before the ambulance even reaches the emergency doors. With the patient positioned and the time noted, your next challenge is to ensure absolute physical stillness until help arrives. Instruct the patient to remain completely motionless and discourage them from trying to move their limbs to test their strength. Every muscle movement requires oxygen and energy, which steals vital resources away from the brain when it is already starving. Any physical exertion increases the metabolic demand of the body, worsening the oxygen deficit in the affected brain tissue. Keep the patient warm and comfortable to prevent shivering, as shivering is also a form of muscle movement that consumes energy. Reassure them that resting is not giving up, but rather an active strategy to preserve brain cells for recovery. Your physical touch and calm voice can help them fight the instinct to move or panic during this frightening experience. By enforcing stillness, you are essentially putting the body into a power-saving mode to prioritize the survival of the brain. We have reached the final and most obvious step, yet it is one that people often delay due to denial. Call emergency services immediately. Do not wait to see if the symptoms pass or try to drive to the hospital yourself. Ambulances are equipped with life-saving technology and can clear traffic, getting the patient to the hospital much faster than you can. Medical care begins the moment the ambulance arrives, not when you reach the hospital, saving precious minutes that determine the outcome. When you call, clearly state suspected stroke, so the dispatcher prioritizes your case and sends a stroke-equipped unit. This alert triggers a chain reaction at the hospital, ensuring a CT scan and neurology team are ready upon arrival. While waiting, unlock the front door and remove any obstacles to ensure the paramedics can enter without a second of delay. Your decisive action in calling for help ensures that the patient enters the professional medical system in the best possible condition. These 7 steps, when performed correctly and calmly, form a powerful defense strategy against the devastating effects of a stroke. By protecting the brain before the ambulance arrives, you are directly investing in the patient's future quality of life and recovery. Knowledge is not just power. In medical emergencies, knowledge is the difference between tragedy and a story of survival. Do not wait for a crisis to occur. Discuss these steps with your family today, so everyone knows exactly what to do. Save this video or write these steps down in your phone so you have a quick reference guide whenever needed. At Smart Wellness Tips, we believe that everyone has the potential to be a lifesaver with the right information and preparation. If you found this guide valuable, please subscribe to our channel to stay updated with more essential health and wellness advice. Share this video with your friends and family. Spreading this knowledge is a simple act that could save a life someday. Thank you for watching Smart Wellness Tips. Subscribe for more life-saving guides and share this video to protect your loved ones.